My name is Kirstyn and I'm going to perform a general survey assessment of the head and neck. Vital signs, height, and weight were obtained previously, and I've washed my hands. Trent Hanna is a 28-year-old male, well-nourished, appears his stated age. Hair and person are neat and clean, ambulatory. Speech is pleasant, clear, and he's cooperative. First, I'm going to inspect and palpate the skin. Denies any rashes, tumors. Texture is smooth. Temperature is warm and even. Free from any lesions. Can you lean forward a little bit? Skin is free from odor. Good vascularization noted to the skin. Do you have any skin conditions that I need to be aware of?
No.
Hygiene is clean. I'm going to inspect and palpate the nails. Nail beds are clean, pink, and round. Well kept. They're smooth and kept short. Capillary refill is less than 3 seconds. There's good adherence to the nail bed and no inflammation. Can you put your 2 fingers together like this? Do it like this. There you go. And then inspect the angle of the nail. So window noted, good. Convex at 160 degrees. And then inspect and palpate the hair. Scalp is pink. No lesions. Scars. Any tenderness?
No.
He has full hair. Distribution is even. No infestations or inflammation. Hygiene is clean, and the patient is well groomed. Next, I'm going to inspect and palpate the scalp and head. No lesions, normocephalic. The head is round, symmetrical, upright, and still. No movement of the head is noted. Face is symmetrical, round, no facial weakness. Can you raise both eyebrows? Frown. Close both eyes. Try to open them. Okay. Can you please show your upper and lower teeth? Smile. Puff out your cheeks. There's good symmetry of the eyebrows, lids, cheeks, and mouth. Any tenderness?
No.
Okay. Scalp is easily moved. No lesions, lumps, or scaliness. Is your scalp tender,
No.
Okay. Next, I'm going to ask you if the sensation that you feel is sharp or dull.
Sharp. Dull.
Next, I'm going to assess cranial number 5. Can you please clench your teeth? Cheek muscles are strong. Next, I'm going to inspect and palpate the neck. No atrophy noted. Can you please shrug your shoulders upwards? Strong muscles of the trapezius muscle. Go ahead and relax. Go ahead and turn your head to the side. Go ahead and turn this to the side. Equal movement, good strength. I ask you to look up and down. Good. Tuck your chin. To the right, to the left, ear to shoulder, and ear to shoulder. Good range of motion. No scars or masses noted to the neck. Symmetrical and good range of motion. Are you having any pain?
No.
Assess the trachea for positioning and tugging. Trachea is midline symmetrical, no deviation. I'm going to inspect the neck for the thyroid. Ask you to tip your head back. I'm going to give you a drink of water, small drink, and hold it in your mouth. Take a swallow. Okay, one more time. Swallow. Thank you. No enlargement or tenderness noted. I'm going to assess the carotid. No distension noted. Assess the anterior and posterior triangles. Going to next assess and palpate lymph nodes with the palms of my hand. No lymph nodes noted as inflamed. Next, I'm going to inspect and palpate the eyes. Any tenderness?
No.
No edema or nodules noted. Look at me. Okay. And then dim the lights for the next test. I'm going to check for pupil accommodation. straightforward. Jump. Assess the lacrimal glands. No swelling noted. If at any time you need a break, just let me know. Assess the orbital area. No edema or sagging or drainage or lesions noted. Can you please close your eyes? Eyelids cover the full globe of the eye. Eyelashes are equal and evenly spaced. Open your eyes. Eyes are symmetrical when opening. Gonna next check the conjunctiva. Okay. Look up. And pull your eyes. Conjunctiva. Are clear and free of any swelling. No inflammation, edema, tremors noted. Sorry. No flakiness. They're inapparent and clear. I'm going to check for corneal clarity. No scars. Abrasions or ulcers. Or cloudiness. Iris is blue. Same color, both eyes. No irregularity. Round, regular, and equal. Look straight forward. Next, I'm going to inspect the eye. Lens clarity is transparent. Red reflex is present. Retinal color is an orange to yellow. Blood vessels, the inferior and superior temporal artery and veins, and inferior and superior nasal veins and arteries are present. The optic disc is visible, sharp, and well defined. The optic fundus exceeds half the horizontal diameter of the optic disc. The macula is a light dot with avascular area. And the disc is a cream color. Next, I'm going to do a vision testing. I'm going to check for visual acuity with a Snellen chart or a near vision chart. Okay. Just tell me when you see my hand.
No. 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 No.
Straightforward. I'm going to check for the 6 cardinal directions of gaze. And nystagmus noted. Finally, I'm going to assess ears, nose, and throat. Gonna inspect and palpate the ears. Ears are pink, round, symmetrical, patent. Any pain or tenderness?
No.
No masses or lesions noted. No deformities. External meatus is free of sermon and discharge. Foreign bodies, lesions, masses, tenderness. Ears are at a 10-degree angle. Tympanic membrane is what I'm going to assess next. I'm going to pull the ears upward and back. Tympanic membrane is pearly gray, translucent in color. With visible landmarks. The paratensive, pars flaccida, no perforations, contours, conical, no inflammation or edema or tenderness noted. Next I'm going to do the Weber test. So what I'm going to do is place this into the center of your head, and you're going to tell me if what you hear is lateral to one side or the other, or if you hear it in both ears. Okay? Do you have any questions?
Same, or even.
Okay. I'm going to do the Ryan's chest next. This is air conduction. I'm going to put it right here in the back of your ear. Tell me when you no longer hear the sound. I'm going to put it next to your ear and tell me when you no longer hear the sound.
I don't hear it anymore. I don't hear it anymore.
Air conduction is 2 times as long as the bone conduction. Next, I'm going to perform the whisper test, which is cranial nerve 8. You can go ahead and close this ear. I'm going to whisper something in your ear and repeat back to me.
3T9.
Okay.
4PC.
Okay. Going to inspect and palpate the nose. Nose is round, free of any deviations, patent. Any tenderness?
No.
No discharge or swelling. Take a breath in. Okay. Alright. I'm going to ask you to go ahead and close your nostril and tell me what the smell is.
Vanilla.
Close this one.
Coffee.
The external nose has no deviations, perforation, mass, discharge, bleeding, or foreign bodies. Septum is midline, no perforations, foreign bodies, or edema. I'm going to inspect and palpate the mouth. Lips are pink, slightly chapped. Go ahead and actually. I'm going to assess the internal and exterior lips. Internal lips are pink and red. No nodules noted. Then assess the gums. Pink. Lips are symmetrical with movement. Then assess the teeth and gums. Go ahead and open your mouth for me. Stick out your tongue. Clean, no odor. Equal spacing of the teeth. Smile. Gingiva are pink and free from tenderness or swelling. Stick out your tongue one more time. Tonsils are pink, free from edema, swelling. Swell the uvula. Salivary glands, free from obstruction. Hard and soft palates are free from many masses, in good condition. That concludes this assessment.